What if I told you that the position you sleep in tonight, even something as simple as not sleeping on left side, could be the difference between waking up tomorrow or not getting that chance? Not during the day, not during stress, not during exertion, but quietly in the middle of the night.
3 weeks ago, I lost a patient who did everything right, except what he did every night. His name was Harold Bennett. He was 74 years old, living in a quiet suburb just outside Columbus, Ohio. And like a lot of people his age, he had structure. He woke up early every morning, made his coffee, sat down and read the news. No rush, no chaos, just a steady start to the day. By mid-morning, he'd step outside and walk around the block. Nothing intense, just enough to stay active. The kind of simple routine I recommend all the time when I talk about sleep tips for seniors and long-term heart health tips. He wasn't trying to push limits. He was trying to stay consistent. And consistency matters. His medical profile reflected that. Blood pressure, controlled. No smoking history. Weight, stable. Medications, taken exactly as prescribed. If you looked at his chart, you would say he was doing better than most people his age. Even his evenings were disciplined. Dinner early, nothing heavy. He understood the basics of avoiding reflux. He'd sit in his recliner, watch TV, and by 9:30, he was in bed. Regular sleep. No complaints, no signs of irregular sleep and heart health problems. On paper, this is exactly what most people believe is enough for stroke prevention. And yet, one morning, Harold didn't wake up. No warning, no emergency, no final symptoms. He went to bed and never came out of that sleep. The cause? A stroke. During sleep. Now stop for a moment and think about that. Because when I went back through everything, every test, every visit, every note, there was nothing in his daytime life that explained what happened. Nothing. And that's what makes this dangerous. Because millions of people over 60 believe that if they follow basic stroke prevention tips, eat well, stay active, take medication, they're protected. But Harold did all of that, and it still wasn't enough. So the real question becomes, what are we missing? What is happening in the one part of your life you don't track, don't measure, and almost never think about? Those 6 to 8 hours every night when you're completely still. Because here's the uncomfortable truth. Sleeping position stroke risk is real, and for most seniors, it's completely ignored. We talk about the best sleeping position for comfort. We share sleep better tips for pain. But we rarely talk about sleeping position for seniors as something that directly affects survival. And we almost never say this clearly enough. There are positions you should avoid after 60. Positions that feel normal, but quietly increase your risk of heart attack during sleep and stroke over time. When I spoke to Harold's daughter, she mentioned something simple, something most people would ignore. He always slept on his back, every night, same position. That was it. No one had ever told him to question it. No one had ever explained that the best sleeping position after 60 isn't just about comfort. It's about how your body functions when you're most vulnerable. Because what failed Harold wasn't his daytime routine. It was what his body went through, night after night, in a position he trusted. And if you're over 60, there's a very real chance you're doing the same thing right now. Before we go any further, let me ask you to do one thing. If stories like this make you stop and think about aging, about independence, about what really matters, take a second to like this video and subscribe. This channel shares stories that don't sugarcoat getting older, and today's story might change how you see it entirely. Because what I'm about to tell you isn't theory. It's what happened to a man who did everything people consider responsible for his health, and still paid the price for something he never knew he was doing wrong. Now, let's continue the story. When Harold went to sleep that night, nothing about his body was resting in the way we usually think. There was no shutdown, no pause. Inside his brain, one of the most critical survival systems he depended on every single day was just beginning its work. Because sleep is not passive. It is not just recovery. It is repair. And more importantly, it is your brain's only chance to clean itself. There is a system most people have never heard of. Even patients who have been dealing with aging health tips and medical advice for years have never been told this. It's called the glymphatic system. And if you're over 60, this system may be one of the most important pieces of stroke prevention you've never been taught. Here's how it works. When you fall asleep, your brain doesn't stay the same size. It actually shrinks slightly. Just enough to open tiny spaces between the cells, and through those spaces, a clear fluid begins to move. Cerebrospinal fluid. Slow, steady, constant. Think of it like a cleaning system that only turns on when you're asleep. It moves through your brain, flushing out waste that builds up during the day. And some of that waste is dangerous. One of the most important is beta amyloid. You may have heard of it in connection with Alzheimer's disease. But it's not just about memory, it's about inflammation. It's about damage to the blood vessels inside your brain. If that waste is not cleared properly, it doesn't just disappear, it builds up. It triggers inflammation. It weakens the structure of your blood vessels. And over time, it creates the exact conditions that increase your risk of a stroke, especially during sleep. Now here's the part almost no one includes in sleep tips for seniors. That entire cleaning process depends on your sleeping position. Not your mattress, not your pillow, your position. This is where sleeping position stroke risk becomes real. Because when your body is aligned correctly, that fluid flows freely. The brain clears waste efficiently. The system works the way it was designed to work. But when your position restricts that flow, everything slows down. Waste stays longer than it should. Inflammation builds quietly, and over time, that creates a dangerous environment inside your brain. This is why sleeping position for seniors is not just about comfort. It is about whether your brain can protect itself while you sleep. And here's the uncomfortable truth. Most people are not in the best sleeping position for that system to work properly. They are using positions they've trusted for decades, positions that feel normal, positions no one has ever told them to question. And the worst part is, you won't feel it happening. There's no warning, no pain, no signal, just like Harold. Everything seems fine, until one morning it isn't. Because what your brain fails to clear at night doesn't just disappear. It starts affecting everything else your body depends on. And one of the first systems to feel that impact is your blood pressure. There's something your doctor rarely tells you. Because when we talk about blood pressure, we almost always focus on what happens during the day. We measure it in the clinic. We track it at home. We adjust medication based on those numbers. But what happens to your blood pressure at night? That's where the real risk begins. Your body is designed to follow a natural rhythm. During the day, your blood pressure rises. That's normal. You're active. Your heart is working harder. But at night, something critical is supposed to happen. Your blood pressure should drop. This is called nocturnal dipping, and it's one of the most important but overlooked stroke prevention tips, especially for seniors. When your blood pressure dips, your blood vessels get a break. Your heart gets relief, and your brain is protected from constant pressure. But for millions of older adults in the United States, that doesn't happen. They are what we call non-dippers. Their blood pressure does not fall enough during sleep. Sometimes it doesn't fall at all. In some cases, it actually rises. And here's the dangerous part. They don't know it. During the day, everything looks controlled. Their doctor tells them their numbers are good. Their medication seems to be working. But at night, their blood vessels are still under pressure. Hour after hour, no relief, no recovery. Now think about what that does to your brain. Those small, delicate blood vessels, already dealing with aging, inflammation, and reduced efficiency, are being exposed to constant stress. That pressure causes micro-damage, tiny injuries you don't feel, tiny weaknesses that build over time, until one night, something gives. And that's when a stroke happens. Not because of something dramatic during the day, but because your body never got the chance to recover at night. Now here's where it all connects back to something most people ignore. Your sleeping position. Because your position affects circulation. It affects how easily your heart can pump blood. It affects how pressure is distributed throughout your body. When your circulation is restricted, Even slightly, your heart has to work harder. And when your heart works harder, your blood pressure stays elevated, even when you're asleep. This is why sleeping position stroke risk is not just about blood flow. It directly affects your blood pressure as well. It's all connected. Your brain, your heart, your blood vessels, and how they behave during those silent hours when you think everything is under control. Because the truth is, it's not just your diet or medication. Your sleeping posture is silently shaping your blood pressure every night. And for many people over 60, the position they've used for decades is quietly working against them. Not enough to cause symptoms right away, not enough to trigger alarm, but enough to slowly increase risk, night after night. And when your blood pressure stays elevated through the night, it's not happening in isolation. It's happening because your heart and your circulation are being forced to work harder than they should, at the exact time they're supposed to recover. This is where we get to the center of the problem. Your heart. Now, most people imagine the heart sitting perfectly in the middle of the chest, balanced, centered, symmetrical. But that's not how your body is built. Your heart sits slightly to the left. It's angled, tilted, designed in a very specific way that most people never think about when they consider the best sleeping position or follow basic heart health tips. And here's why that matters. Your heart has been working non-stop for decades, 70 years, sometimes more, beating over 100,000 times a day, never taking a break, never stopping. Even when you sleep, it doesn't shut off. It just hopes for one thing: less resistance, less pressure, less effort. But when your sleeping position is wrong, that's not what happens. Instead, your heart is forced into a position where it has to work against gravity. Not with it, against it. And the simplest way to understand this is to picture something very familiar. It's like pushing something uphill while you're already exhausted. Not impossible, but harder than it needs to be. And now imagine doing that for 6, 7, 8 hours straight, every single night. This is why sleeping position stroke risk is not just about the brain or blood pressure. It starts with the mechanical workload placed on your heart. Because when your heart has to work harder, everything else begins to follow. Now let's take this one step further. Because the heart doesn't work alone. It depends on blood returning to it efficiently. This process is called venous return. And it's one of the most overlooked factors in stroke prevention, especially in seniors. There is a major vein in your body called the inferior vena cava. It runs along the right side of your spine. Its job is simple, but critical. It carries blood from your lower body back to your heart, every second, every minute, all day long. But here's the problem. When you lie in certain positions, especially positions many people consider normal, this vein can be compressed, not completely blocked, but enough to slow things down. And when that happens, blood doesn't return to your heart as easily. It starts to pool in your lower body, your legs, your lower extremities. Circulation becomes less efficient, and your heart now has to work even harder to maintain flow. This is where everything begins to stack. Reduced venous return, increased cardiac workload, elevated nighttime blood pressure, all happening while you believe your body is resting. This is why sleeping position for seniors becomes such a critical part of long-term health. Because after 60, your circulation is already less efficient than it used to be. Your vessels are less flexible. Your response time is slower. And if you combine that with a position that restricts blood flow, you're amplifying the problem. Now think about daily life in the United States. Many older adults spend a large part of their day sitting, watching TV, driving, resting. Movement is reduced. Circulation slows during the day. And then at night, instead of correcting that, the wrong sleeping position continues the same pattern. Less movement, more restriction, more pressure on the system. This is how risk builds. Not suddenly, but gradually, night after night. This is why when we talk about sleep tips for seniors or the best sleeping position after 60, we cannot separate comfort from physiology. Because what feels comfortable is not always what's best for your heart. And what you've been doing for years may not be what your body needs now, especially when it comes to protecting yourself from heart attack during sleep or long-term cardiovascular damage. And here's the part that most people never realize until it's too late. While you think your body is resting, your circulation may be struggling. And when circulation struggles long enough, something far more dangerous begins to form. This is where we reach the point most people never see coming. Because what starts as slower blood flow can turn into something that can kill you in minutes. It's called thrombosis, and the explanation is simpler than most people expect. When blood moves, it stays fluid. When blood slows down, it thickens. And when blood sits still for too long, it can clot. That clot can stay where it forms, or it can travel. Now think about when your body is most still. Not during the day, not when you're walking. At night. Lying in one position for 6, 7, sometimes 8 hours. This is why sleeping position stroke risk is not just a theory. It is directly tied to how long your blood stays in one place without movement, especially for seniors. Because as we age, circulation naturally slows down, vessels stiffen, flow becomes less efficient. And when you combine that with the wrong sleeping position for seniors, you create the perfect condition for clot formation, blood pooling in the lower body, reduced venous return, pressure building slowly inside the system. Now here's the dangerous sequence. A clot forms in the leg. It breaks loose. It travels through the bloodstream, and if it reaches the brain, it blocks blood flow instantly. That's a stroke. No warning, no time to react. This is how a heart attack during sleep or a stroke can happen to someone who felt completely fine just hours before. This is why stroke prevention after 60 cannot ignore what happens at night. Because this is the window where risk is at its highest. And yet, most sleep tips for seniors never explain this part clearly. They focus on comfort. They focus on getting enough hours, but they don't explain how dangerous stillness can become when combined with the wrong position. Now let's add another layer. Because thrombosis is only part of the story, there's another condition that millions of older Americans deal with every single night, and most of them don't connect it to stroke risk at all. Acid reflux, or GERD. You know the feeling. That burning in your chest. That discomfort after lying down. Many people treat it as an inconvenience, something to manage with medication or diet. But here's what's really happening inside your body. When acid repeatedly flows up from your stomach, it irritates the lining of your esophagus. That irritation doesn't stay local. It contributes to chronic inflammation. And chronic inflammation is one of the key drivers of vascular damage. It affects your arteries. It accelerates the buildup of plaque. It weakens the structure of your blood vessels over time. This is how a simple digestive issue becomes part of a much larger cardiovascular problem. Inflammation leads to atherosclerosis. Atherosclerosis leads to narrowing of the arteries. And that narrowing increases the likelihood of a clot causing a blockage. Which brings us right back to stroke. This is why understanding sleep positions explained properly is critical after 60. Because certain positions make reflux worse. Certain positions allow acid to move more freely into the esophagus. And certain positions many people use every night, quietly increase inflammation over time. This is also why many experts now emphasize the best sleeping position for healthy heart function includes reducing pressure on both circulation and digestion. Because your body is not dealing with just one issue. It's dealing with multiple systems, all affecting each other. Your blood flow, your inflammation levels, your vascular health, and how all of that behaves during sleep. So when people ask for simple aging health tips, they often expect one answer, one solution. But the truth is more complex and more serious, because what you're facing is not one isolated problem. It's a sequence. A progression, a chain reaction that builds quietly over time. Blood flow slows, pressure increases, inflammation rises, clots form, risk escalates, and eventually, something breaks. That's why the most important realization in all of this is simple but powerful. You're not dealing with one problem. You're dealing with a chain reaction, and once you understand that, the question becomes very simple. So what could have changed everything for Mr. Bennett? What could have interrupted that chain before it reached the point of no return? The answer is not a new medication. It's not a complicated treatment. It's not something expensive. It's something so simple. Most people overlook it completely. Sleeping on your left side. That's it. And I know what you're thinking. How can something that simple possibly affect something as serious as stroke prevention or heart attack during sleep? But when you connect everything we've just talked about, it makes sense. When you sleep on left side, your heart is no longer working against gravity. It's working with it. The workload drops. The pressure on your system decreases. And for a heart that has been working for decades, that difference matters more than most people realize. At the same time, your blood flow improves. That major vein we talked about, the one responsible for returning blood to your heart, is no longer compressed the way it is in other positions. Blood moves more freely. Circulation becomes more efficient. Pooling is reduced. And when blood keeps moving, the risk of clot formation goes down. This is one of the most important stroke prevention tips that rarely gets explained clearly in sleep tips for seniors. Now think about your brain. When you're in the best sleeping position for healthy heart function, that cleaning system, the glymphatic system, works better. Fluid flows more efficiently. Waste is removed faster. Inflammation is reduced. And your brain is protected during the hours it needs it most. Your blood pressure also benefits. When your heart doesn't have to work as hard, when circulation is smooth, your body is more likely to reach that natural nighttime drop we talked about earlier. Lower pressure, less stress on your vessels, better long-term protection, and then there's something most people ignore. Acid reflux. When you sleep on left side, your stomach is positioned in a way that keeps acid down. Less irritation, less inflammation, less long-term damage to your arteries. This is why many experts now consider sleeping on left side the best sleeping position after 60, because it supports everything at once. Your heart, your circulation, your brain, your vascular system, all working together. Now let me be clear, you don't need to be perfect. You don't need to stay in one position all night. Your body will move. That's normal. What matters is where you start, your default position. And there are simple ways to make that easier. Place a pillow behind your back. It helps prevent you from rolling onto your back. Put a pillow between your knees. It keeps your body aligned and makes the position more comfortable. These are simple adjustments, but they work. This is what real sleep positions explained should look like. Practical, simple, effective. Because after 60, it's not just about what feels familiar. It's about what protects you. And it's also about knowing what to avoid. Avoid this sleeping position after 60, lying flat on your back every night, if it's working against your circulation and your blood pressure. Because the risk doesn't come all at once. It builds, quietly, night after night. I still think about Mr. Bennett. Not because he ignored his health, but because no one told him this. No one explained that something as simple as sleeping position could affect everything. His heart, his brain, his blood vessels. So tonight, when you get into bed, just try it. Roll onto your left side. Let your body adjust. Give your heart less resistance. Give your brain a better chance to clean itself. Give your blood a smoother path to move. Because sometimes, the difference between risk and protection isn't a major decision. It's a small change, repeated every single night. And if this made you stop and think, even for a moment, if it changed the way you look at something as simple as your sleeping position, then take a second to like this video and subscribe. Because this channel is here to give you real, practical information. The kind most people don't hear until it's too late. And more importantly, share this with someone you care about. A parent, a partner, a friend over 60. Because the right information at the right time can change everything.